All right, it is 12:02. We're going to go ahead and get started. Thank you all for joining us today. Just before I introduce myself and we start the webinar, a couple of Zoom housekeeping. If you have any questions during our time together today, feel free to put them in the chat box or you can throw them in the Q&A box, and then we will go ahead and visit those questions at the end of the presentation. So, welcome everyone. May is Mental Health Awareness Month, and today's webinar will be on co-occurring disorders with Partnership to End Addiction. My name is Bree Guzman, and I am the Prevention Manager at notMYkid. notMYkid, we are a nonprofit specializing in prevention and behavioral health for youth and families. And just a little bit more about notMYkid, our mission is to ensure every kid thrives by inspiring positive life choices. Our commitment is to offer the best prevention and behavioral health services to protect youth mental health, and to leverage the power of lived experience. We make a difference in the community by educating people to build resiliency, inspire hope for the future, and grow connection and communication. Today with us, we have Partnership to End Addiction, a national nonprofit organization based in New York City. Partnership's mission is to transform how our nation addresses addiction by empowering families, advancing effective care, shaping public policy, and changing culture. Today joining us, we have Dr. Linda Richter and Corey Hammond. I will let them take it over from here.
Great. Thanks so much, Bree. Thanks for having us this afternoon. We are really excited to bring you this next installation of our parent webinars. Today, we're going to be talking about co-occurring mental health and substance use problems. Throughout the presentation, you might hear us call this co-occurring disorders or COD, but we'll get into kind of what that means and what it means for young people. But first, a quick introduction of who we are. My name is Corey Hammond, and I am the Director of Prevention Services at Partnership, and I'm joined here by my colleague, Dr. Linda Richter, who is the Senior VP of Prevention Research and Analysis at Partnership. And this presentation was created with the help of our research assistant, Olivia Root, as well as Pat Awesome, who is one of our colleagues at Partnership that works on the clinical side of things. So what we are going to talk about today is substance use, mental health, and then co-occurring disorders, which is the unfortunate combination of both of those things. We're going to talk about the prevalence of co-occurring disorders and how common it is among youth. We're going to talk about risk and protective factors for co-occurring disorders. We'll talk about the current treatment landscape and what some of the barriers to treatment are today. And then finally, we'll wrap it up with what parents, teachers, and other professionals can do to help young people who may be struggling with co-occurring disorders. And at the end, we will share some resources, both from the partnership and from some of our external partners. And we will hopefully have time for questions at the end. As we're going through, if you have any questions, please feel free to use the chat or the Q&A option, and we will be able to answer any questions you might have at the end. So jumping right into it, we're going to talk about youth substance use, mental health, and the combination of the two, known as co-occurring disorders. So looking at substance use disorder, we use this term SUD, substance use disorder. You might also know it as addiction. There is a strict diagnostic definition for what qualifies as a substance use disorder or what qualifies as an addiction. The definition of substance use disorder is an impairment caused by the recurrent use of substances despite harmful consequences and lasting changes to the brain. And so you'll see here on this slide, there are 11 different criteria and kind of symptoms of a substance use disorder, and how severe someone's substance use disorder is dictated by how many of these symptoms that they're experiencing. Some of these might be very familiar to you, things like difficulty cutting back, time spent using, and recovering from use of substances, having intense cravings, not being able to keep up with their responsibilities, giving up on things that they used to like, problems with relationships, putting themselves in physically dangerous situations, and then things like tolerance and withdrawal. And so at the bottom, you'll see that 2 or 3 of these constitutes a mild substance use disorder, 4 to 5 is moderate, and more than 6 would be severe. And so we're going to talk a lot about the clinical criteria for both substance use disorder and mental health disorders and what it looks like when the 2 of those are coexisting at the same time. And so thinking about substance use disorder among teens, among young people aged 12 to 17, almost 9% met that diagnostic criteria for a substance use disorder or an addiction. And only 40% of those who needed treatment received it. And Linda will talk about later in the presentation how that number is even lower for people who have both a substance use disorder and a mental health disorder at the same time. And we know, if you've been to one of our webinars before, you'll know that we talk about this point very frequently. The idea that the earlier someone starts to use substances, the higher their risk for developing a substance use disorder or an addiction. You'll see the graph on the left is that of alcohol. So you'll see as age of first use of alcohol increases, the risk for developing an addiction to alcohol decreases. So for those who tried alcohol at age 12 or younger, almost 12% went on to develop an alcohol addiction. Meanwhile, the odds for those who waited until 21 to try alcohol are about 5 times less. Similar story with marijuana, you'll see on the right. Individuals who start using marijuana 12 or younger have about 8 times higher odds of developing an addiction than those who wait until they're 21. And so this is why we say constantly to try to delay onset of use for as long as possible as a harm reduction technique. We know that the earlier someone starts their substance use, the more serious the consequences are. And the consequence that we're going to be talking about today is the development of a co-occurring mental health disorder. So the mental health landscape for young people. Teens, we know that the Surgeon General recently has come out saying that there is an epidemic, a youth mental health crisis in the United States right now. About 65% of teens feel that the world is more stressful now than when their parents were their age. 1 in 6 report experiencing specific negative emotions either all the time or often, and 1 in 4 have been diagnosed with a mental health condition. And we'll talk about some of the specific mental health conditions that oftentimes go alongside a substance use disorder. But an important fact that we know, oftentimes parents might think that the chances of a mental health disorder, if it's going to happen, it's not going to happen until someone's 18, 20, 25. But we know from research that almost half of all mental health problems surface by age 14, and 3/4 of them will surface by the time someone is 24. So these are problems that are happening in young children. And there's a lot of symptoms and signs that we can be on the lookout for in young children to know who might be at risk. This is CDC data from the Youth Risk Behavior Survey from 2021, just kind of highlighting how common a lot of the youth mental health challenges are. You'll see that over 40% of students said that they have experienced persistent feelings of sadness or hopelessness in the past month. Almost 30% said that they have experienced poor mental health in the past month. Over 20% have seriously considered attempting suicide. 10% have attempted suicide, and about 3% were injured in a suicide attempt and needed care by a doctor or nurse afterwards. And so these are certainly alarming numbers. We know that an alarming number of adolescents are reporting serious mental health disturbances and suicidality. And so we don't want to be blind to this issue. If we know what kids are most at risk, and if we know what it looks like, then we can get out ahead of it and get kids the help that they need before it becomes serious. And so now I'm going to pass it over to Linda to talk about co-occurring disorders and what that means in young people.
Thanks, Corey. I think most people know that mental health is related to substance use. I don't think that comes as a surprise to most people that kids who are young people and adults who struggle with their mental health are more prone to substance use and the risk of substance use disorder. But it's become clear to us over the years in the research and work that we do that the connection is not as obvious as it should be. And um, because of that, they're not talked about together. They're not, prevention programs don't often address the two issues as intertwined as it is. And certainly treatment programs don't address them together the way they should. So we kind of want to really get into it a little bit, how these two problems, issues, conditions interrelate, what brings them on together, or what makes it more likely that they will co-occur. Co-occur means occur together, so substance use and mental health issues, and what we could do about it. So just for a quick definition, I know Corey alluded to it, but essentially co-occurring disorders is the presence of both one or more mental health disorders and one or more substance use disorders. And today we're going to talk about it both as the substance use disorder, mental health disorder level, which is like a clinical diagnosis, but also the preclinical level where kids might be experiencing mental health issues or substance use problems, and how those two relate as well. So certainly once it hits the clinical diagnosis, that's super important, but there's a lot of ground to cover before someone is formally diagnosed with a co-occurring disorder, where there's a lot of room to kind of prevent that, even if a young person has some mental health issues and some substance use problems. So that's what we really want to focus in on. And typically for adolescents and younger, that is where the opportunity is. We also know that these disorders, a co-occurrence occurs in people across demographic groups. It is not really more likely to be seen in males versus females or in one race, ethnicity or another. It's pretty much across the board, although there's some minor differences in people who experience co-occurring disorders. And the reason it's really important to consider them together and not just as two separate but parallel problems is because compared to people who only have a mental health disorder or only have a substance use disorder, those who are dealing with both tend to have much worse experiences from it, much worse impairment. So that, the symptoms that they experience could be worse. It's harder to treat them effectively if they have both disorders as opposed to just one. Some of that is because our treatment system is not set up well to treat people who have both, but some of it is just because the symptoms and the complexities are greater than if somebody has just one of the disorders. We do know that people with co-occurring disorders are more likely to experience a whole range of illnesses and also to have a higher rate of death. We know that it's really expensive to treat people who have both disorders, again, because of how our system is set up. And people with both substance use and mental health disorders together are at higher risk for homelessness, for incarceration, and certainly for suicide as well. Again, some of that is because of our society and stigma, and we're not really equipped to address people who have both disorders simultaneously as well as we should be. But also because experiencing both really does increase the severity of symptoms and makes it harder to treat and address. So just a quick look at some data, which we're not going to dwell on, but it's just good to know that in the year 2022, so that's kind of recent, we had from survey data 22 million adults in the United States who could be identified as having a co-occurring disorder. 22 million is a pretty high number for something that we don't really talk about all that much. And for many of you, the term co-occurring disorders might even be a new term. So that's because a lot of people are not familiar with it, but yet it affects quite a significant portion of our population. That's adults. And when we talk about young adults, it's about 5.3 million. And about 1 million adolescents aged 12 to 17 have what can be diagnosed as a co-occurring disorder. The research that's done on adolescents looks specifically at depression as the mental health issue. So it's not even taking into account a whole range of other mental health issues that might be co-occurring with substance use disorders in adolescents. So I would argue the 1 million estimate is really quite low. But nevertheless, a significant portion of our kids are struggling with this issue. And many of those have what's called severe impairment when it comes to the depression side of things. So it's not just any depressive episode, it's being severely impaired because of it. In this case, for adolescents, we do see higher rates among females than males of kids with co-occurring disorders for whom depression is the mental health problem. We also know that only about 20% of kids, adolescents, are receiving treatment for both the problems, the substance use disorder and the major depression. And if they are receiving treatment, they're more likely to be receiving treatment for the depression than the substance use. So 50% will receive treatment for their major depression, but not for their substance use problem. Only 2% receive treatment for just the substance use without the depression being treated. Regardless, the point here is that a significant number of kids are experiencing co-occurring disorders and far too few are receiving the treatment they need for it. It's also important to note that, we can go to the next slide, thank you, that this is a two-way relationship. If a person is struggling with negative emotions, wanting to kind of ease their untreated symptoms of some sort of mental health problem, they might turn to substance use to do what we call self-medicate, or to kind of treat those symptoms themselves with substances if they're not having their mental health problem treated effectively by a doctor or a therapist. So what we do see is that the relationship between substance use problems, mental health problems is bidirectional, can go either way. About 30 to 45% of teens and young adults who have a mental health disorder also have a co-occurring substance use disorder. And if you only look at people who first have a substance use disorder, about 2/3 of them also have a mental health disorder. So we have to really see how these two go together so frequently in kids and in adults. You can go to the next slide. So it's just important to understand what some of the mental health issues are that tend to co-occur or be present when someone uses substances. So here on this slide, you see some of the key ones. There are really many, but these are the main ones that you might see in young people. And we'll talk a little bit more in detail about how each of these relate to substance use. So we have here major depression, which is kind of a clinical term for serious depression. You can go back just for one more second, Corey, please. Thanks. Major depression, which there's different types of depression, anxiety disorder. So there's different kinds of anxiety disorders as well, but it's things like social anxiety or generalized anxiety or panic disorder. You may have heard of some of those. We know a lot of kids are diagnosed with attention deficit hyperactivity disorder, ADHD. Eating disorders are certainly a problem among adolescents and early adults, and that has high rates of co-occurrence with substance use. Post-traumatic stress disorder, not as common, but certainly a problem in kids, especially those who have experienced persistent trauma or stress in their life. Bipolar disorder and schizophrenia. So we'll go into each of these just a little bit, mostly focusing on how they relate to substance use. So to start with depression, because again, that is probably the most common one that we see. We know that teens with depression are about twice as likely as those without depression to use substances. And we also know that teens with depression are about 3 times as likely to have a clinical substance use disorder. So if you look at the bars here, you'll see that the purple is people who have depression. The yellow or orange is those who do not have a major depressive episode, which is the clinical term for depression. So whether it's alcohol, nicotine vaping, marijuana use, other illicit drug use, or prescription drug misuse, in every case, the rate of use of that substance is 2 or more times as high among those who have a depressive disorder compared to those who do not. So this is a really strong relationship between the two conditions. So why do we see this? What's the reason that depression and substance use is so tightly related? So it's not surprising. Kids may use substances because they might want to dull the painful feelings that they have that comes with depression, or to cope with the persistent negative thoughts. That's a feature of depression as well. We know that about a third of people who have depression also have substance use disorder. Um, and substances affect the parts of the brain that bring on that are reinforcing or give us what we call reward. It's the same areas that are associated with depression in many cases. So when substances are used, it could temporarily alleviate the symptoms of depression to some extent. And when they are not using substances, those symptoms could feel worse. Alcohol use is especially damaging, especially for young people, because it affects adolescents differently than it does adults. So instead of getting sedated, as a lot of adults do, or kind of, calmed when they use alcohol, teenagers tend to get more energized. And that can make them engage in more risky behaviors, including harming themselves, especially if they have depression. So the link between depression and alcohol looks a little different for adolescents than it does for adults. You can go to the next slide. We also care a lot about anxiety when it comes to kids, which is also very common among young people today. So when we talk about the mental health crisis, the two problems that typically come up are depression and anxiety in kids. So those are really important, and they also are very likely to co-occur with substance use. So for anxiety, we know that kids, young people can use substances to try to alleviate or relieve some of the anxious feelings and symptoms that they have. It can calm them down. It can make them feel better. Again, temporarily, but the effects of the substance, whether it's alcohol or marijuana or nicotine, it kind of masks the symptoms rather than treating it. So it kind of takes them away for a little while, which makes it a little bit harder to detect in young people that they actually have this anxiety disorder. So what you might be seeing in a young person is a lot of drinking, a lot of marijuana use, a lot of nicotine use, other drug use, prescription drug misuse, especially. And then that makes us as adults focus on their substance use. And we may not realize that the reason that they're using all these substances is because they have this underlying anxiety disorder or perhaps a depressive disorder. And therefore, that mental health problem will not be treated or addressed because we're so focused on the substance use. We find that some could feel that their anxiety is more intense when they're not using substances. So again, it's like this loop where kids feel like, well, when I use the substance, when I drink, it makes me feel better. If I don't use it, I feel worse. So therefore, I should keep using it because it's helping. And we know that there was one large survey that found that about 18% of the respondents who had a substance use disorder also had an anxiety disorder. So again, these two things do go together. And we also know there was another study that showed that people who have generalized anxiety disorder, which is the type of anxiety disorder where you can't link the anxious feelings to a particular event or something that happened in your life or some trigger. It's sort of, it's just this generalized feeling that you continuously have of anxiety. So people who have that are more likely to start using substances earlier and to experience a substance use disorder. So again, the reason we're pointing this out is so that adults who care for kids recognize that when they see a young person using substances a lot, what should always be in the back of their mind is, well, what is driving that? And is it possible that what I'm not seeing as the adult in this person's life is that they are experiencing a mental health issue that we need to actually get at and treat? ADHD is another extremely common mental health problem that is treated in young people. And there are certain brain differences in people who have ADHD that make them more responsive to the effects of substances and therefore more likely to keep using them. We know that about a quarter of young adults who have a substance use disorder also have ADHD. About 15 to 25% of people who use cocaine have ADHD. And that's important to know because ADHD is treated with stimulant medications. Cocaine is a stimulant. So a lot of the medications that treat because the medications that are effective in ADHD are stimulants, we know that people who have ADHD tend to be attracted to substances that do a similar thing. So that would be cocaine, it would be nicotine, it would be caffeine, methamphetamine, anything that is a stimulant to the brain. about a third, a little more than a third of young people who who use marijuana or cannabis have an ADHD diagnosis. Again, kids are drawn to the nicotine, to marijuana, and to the misuse of medications. So we know a lot of kids who have ADHD diagnoses and receive medications for it. They themselves could misuse their medications if they're not monitored well. But even more common is that the people around them, their friends and peers, may misuse the medications as well. So we have to be very careful about that, because if somebody who does not have an ADHD diagnosis is misusing ADHD medications, those are stimulants, and that is substance misuse and can cause pretty severe problems. PTSD is not, that's post-traumatic stress disorder. Again, I mentioned it earlier that some kids do have it. We know that about 62% of children and adolescents in the United States have been exposed to a traumatic event. About 16% of those end up having PTSD. We know that for adults, those who have PTSD are 2 to 4 times more likely to have a co-occurring substance use disorder than those without it. And people who seek treatment for substance use disorder, about 50% or more of them have a diagnosed PTSD. But and in most cases, when we're talking about how the two relate, it's the PTSD that comes first. Again, people are self-medicating or treating their symptoms with substances. So for young people, though, I would say the primary mental health issues to consider when it comes to substance use are the depression, anxiety, and ADHD. A smaller number will have PTSD that they self-medicate with substance use. And then finally, there's bipolar disorder, which you may have heard of as well. Nearly 60% of people who have a bipolar disorder have a co-occurring substance use disorder. That's really high. Again, the substances most commonly used among people who have bipolar disorder are nicotine and alcohol. But we also know that if somebody is misusing substances and they haven't yet had an episode of their bipolar disorder, that substance use could trigger, in this case, a manic episode. So bipolar disorder is manic, mania, and depression typically, or fluctuating between the two extremes. And we also know that substance use for people who are being treated for their bipolar disorder, if they misuse substances, it can interfere with the effectiveness of the medication for their disorder. So that's a problem as well. The one that's not written here and that I just kind of want to mention is, we'll probably get to it in a minute, is schizophrenia as well. Very uncommon among adolescents. It usually emerges in early adulthood. However, we know that with the new high potency marijuana products that are out there on the market, and we'll get to this in a minute, it does increase the risk of schizophrenia as well. So speaking of risk, let's talk about how people develop co-occurring disorders. What are the pathways to it? What do we need to look out for? So we know from the research and from clinical experience that there tend to be 3 ways that co-occurring disorders can emerge in people. And they're kind of logical if you think about it. So the first is that a person has some existing or emerging mental health challenge. And that person, as we've been discussing, will turn to substances to self-medicate or to treat those mental health challenges so that they could feel better. So if those mental health issues are not being addressed effectively, a person will try to address them themselves by any means they can. And that might be nicotine, alcohol, marijuana use, illicit drug use, or prescription drug misuse. So that's the first pathway, and it's a pretty common one for young people. Mental health issue, not well treated, so they turn to substance use. The second pathway is it's really kind of both are existing at the same time. So a person might have a predisposition or a tendency to both have a mental health problem and to have a substance use problem. So there's similar kind of vulnerabilities in those people who make them prone to both mental health issues and substance use problems. And those could be things that are in their genetic makeup, their biological makeup, something with their family, maybe an unstable, unhealthy family environment. It could be a whole range of personality issues that kind of make someone more prone to using substances and also to kind of having mental health symptoms. So again, here it is that somebody has both predispositions and then they start using a substance, the mental health gets worse, vice versa, and it kind of escalates from there. And then the third pathway is one that happens quite commonly, but we often don't recognize it or think about it. And that's one I really want to focus on for a minute. It's a person has a change in their mental health status that is caused by their substance use, including prescription medication that they may have been given legitimately. So here you have a case where someone has no real detectable mental health problems. They start using substances, and that substance use brings on mental health symptoms. So we know that's the example I gave a minute ago, that for some people, they may use marijuana that's very high in potency and have a psychotic episode, so just like a really severe mental health problem that comes. It could be short-lived in some people if they're not prone to a mental health disorder, but for others, it could kind of lead to a more permanent mental health problem. We know that people who drink a lot, they start drinking socially and then they get used to it, they become addicted and they drink a lot, they could develop depression or anxiety. We know that people who use a lot of nicotine can develop anxiety and depression as well. So you may not have had those mental health symptoms to begin with, start using the substance, and that brings on the mental health symptoms. The other part that I just want to mention is for prescription drugs, some people, especially young people, are prescribed prescription medications to treat pain that comes with things like a sports injury. They may have had surgery for a sports injury. They may have, a tooth pulled, a wisdom teeth pulled, and the dentist just gives them like a bottle of pain medications. So this could be a child who's like perfectly fine, no mental health issues, no substance use issues, takes a medication as prescribed by the doctor. Again, in most cases, it's a pain medication, and then becomes addicted to that pain medication, and then falls out of their routine, doesn't do as well in school, is no longer engaged in their social activities, may not be able to participate in their sports and other activities that they enjoyed. The depression comes on, the anxiety comes on. So it's, taking a substance and then the mental health symptoms follow from that. So these are the three pathways. Mental health problem brings on the substance use. You have both, a predisposition to both, or the substance use brings on the mental health problem. So for co-occurring disorders, these might look familiar. These are not that different than the risk factors or things that increase risk for a whole range of mental health or substance use issues. But we know for people who have co-occurring disorders, they may have certain differences in their brain structure or how their brain functions. Typically, there's a family history of mental health or substance use challenges, and that's why it's really important to talk with kids who do have that kind of history in their family of mental health or substance use, so that they know that they're more prone to it. The reason for that is not to scare them, but it's to address the fact that when you talk to some kids and say, hey, if you use marijuana, you're at higher risk of developing, schizophrenia or depression or anxiety or becoming addicted to the drug. And the child looks at you and says, oh, come on, all my friends use, they're totally fine. They're getting straight A's, they're doing great in school, they're doing great on their sports. I don't know what you're talking about. It doesn't cause that. And then you could say, that may be true for some kids, but for kids who have a family history or a genetic predisposition, they are at higher risk. In our family, we do have X, Y, and Z, and that's why I just want you to know about it. So the more we talk about these things with our kids in an honest way, the more we're likely to protect them. Other risk factors are obviously stressful events, trauma. Bullying is a kind of stressful event and trauma that is all too common in kids. Having a kind of strained or difficult parent-child relationship, significant life changes or disruptions. So we see these problems more often in kids who are have to move a lot, who go through, a parental divorce that's maybe really difficult. Those kind of like big life disruptions, a sickness in the family, a death in the family. Kids who are not connected to school or to their friends, if they do not feel that like social connection, if they're kind of isolated, if they're not invested in their social group or their school or community, they're at higher risk. And again, it could be like which came first, right? Like, so a kid who has a lot of mental health issues or substance use problems may not be connected. But in this case, what we're seeing is that kids who are not connected well to their social group or their school, that's going to increase their risk of turning to substance use and developing mental health problems. Feeling unsafe at home or school, having chronic illness or pain, obviously, because they may turn to substance use to self-medicate those feelings and those experiences. And the bottom one's an obvious one, but if you're going to use substances or misuse prescription medications, you're going to increase the risk that you'll develop a co-occurring disorder as well. We talk a lot about social media and almost everything we do, but in this case, it's really important because kids who spend many hours on social media are at increased risk of mental health problems. I'm sure you've all heard about that or seen it in your own families or know it. And we know that that's especially true for girls, unfortunately, in this case. But the reason for that is because kids who spend too much time on social media, they're more likely to have disrupted sleep. And we know that when kids don't get enough sleep, they're at higher risk of both substance use and mental health symptoms. They're at higher risk of experiencing cyberbullying. So bullying online or over social media that can make a young person feel depressed or anxious, turn to substance use. We know that kids who spend a lot of time on their phone are not exercising in many cases enough, and that's a risk factor for substance use and mental health problems. And it's particularly risky for the kind of problems, again, that girls experience more than boys even, which is like the anxiety, depression, as opposed to the more outward focused, aggressive or bullying kind of symptoms. But the other point about social media that's really important to recognize is that a lot of prescription pills that kids they try and get it over social media to misuse. And they're very widely available that way. And we just kind of want to keep that in mind because a good portion, if not all of those pills that are available on social media to young people illegally are counterfeit or fake pills. And I'm not sure if we get to this later or not, but always good to mention. Nowadays, the majority of the pills that are out there contain fentanyl, which is that deadly substance that way too many young people are exposed to and are experiencing fatal overdoses from. So social media is really, it's not all bad, but for a young person who has co-occurring mental health and substance use problems, it is particularly dangerous. So what are some protective factors? In many cases, this is the opposite of the risk factor list, but there are some differences here. So certainly having a parent or guardian who is supportive, who is open to the fact that their child might need help, who kind of is very involved in their young person's life so that they could see if the child is experiencing some symptoms that are signals of a substance use or a mental health problem and get them the help that they need. That's why the kind of closeness from parents is really important. Kids who feel safe in the home, in school, and in their community are protected more so from co-occurring disorders. Kids who are kind of care about their health and want to be healthy and maintain a healthy lifestyle are more protected. Those who are fine with engaging in activities that don't involve substances with their friends. Kids who have good coping skills, good problem-solving skills may be less likely to feel depressed or anxious, less likely to turn to substances. Generally resilience. We find that spirituality or religious involvement tends to be somewhat protective. Again, there's the community element, there's the sort of hopefulness, forward thinking element of it. And again, as we always say, having a strong bond with at least one trusted adult. It could be a parent, but better yet, if it's someone in addition to the parent, it could be an older sibling, a cousin, a teacher, a coach, a clergy person, someone in the community. We find that that is a very significant protection for young people from both substance use and mental health problems. So if you do find that a young person is experiencing substance use and mental health problems, how do we help them? And the treatment landscape is a little not as good as we'd like it to be. But one thing we do want to talk about that's really important is this window of opportunity for helping. These are really difficult problems to treat. But when we're talking about adolescence, we know that the time between someone's develops a mental health disorder and then begins their substance use is a key window of opportunity to prevent a co-occurring disorder. So if we see that a young person is experiencing mental health symptoms that are ongoing or persistent, it's really, really important to get that young person help, because if we don't get them the help they need, they are at much higher risk of turning to substance use to medicate and treat themselves. And that's what brings on, or at least that's one of the key pathways for developing a co-occurring disorder. We know that about 90% of people who have had a co-occurring disorder did experience at least one mental health disorder before they started using substances. And usually the mental health disorders emerged or could be seen in early adolescence. The median age is about 11. So that's pretty young. We're seeing mental health symptoms and issues in kids at a pretty young age. And then it tended to be followed by substance use disorder 5 to 10 years later. So we have the mental health disorder, it simmers for a while, it's unrecognized, it's untreated or inadequately treated. And over time, the young person will use substances, and then that substance use will build and build and build and become a substance use disorder. And then by the time a person is in their early adulthood, they have a co-occurring disorder. The point of this is to show that if we kind of get in there fast enough when we see that someone has a mental health problem and help treat that, the risk of developing the substance use disorder and therefore the co-occurring or both is much lower. We do know that once a kid has finally developed a substance use disorder, treating it alongside the mental health problem is much more complicated and difficult. So we want to try and get in there as soon as we can. Unfortunately, there are a whole range of barriers to effective treatment for mental health and substance use disorders or co-occurring disorders. So one is that there's not enough people who are qualified to treat both, unfortunately. We have people who are specialists in substance use disorder treatment, people who are psychiatrists or psychologists who are specialists in mental health disorder treatment, but many kind of don't feel that they can do both at the same time, even though so many people who have one disorder have the other as well. We know a lot of kids just don't want to get treatment. They don't want to be different from their friends. They don't want to stand out. They don't want the attention. So you need to kind of have their buy-in to get effective treatment. So that's a problem. Stigma is a real issue in our society when it comes to both mental health and substance use, and especially for treating mental health and substance use with medications. There's a lot of stigma around that. Payment. It's really hard to afford a lot of good treatment, and a lot of people don't have the insurance that they need. In many cases, just kind of the logistics of getting people to treatment. So there's difficulty in terms of not having adequate transportation, or it's difficult to schedule the treatment around school hours that kids have to be in school, or the work hours that their parents have to be at work. Very hard to find treatment over the weekend when people are home. You may try your hardest and there's long wait lists and people get declined from, entering treatment for a variety of reasons. And we also know that programs that are for adolescents, which are very few, they don't typically offer the best kind of care that they should. And we do know from our research and many others that the best kind of treatment for both substance use and mental health problems for adolescents are those that involve the family in the treatment. There are a few cases where the family is the problem and it makes it worse, but for the most part, it's always better. It's typically better to have the family involved in the young person's treatment if they're getting care. We know that there's been some surveys of parents who have tried to get treatment for their kids who have co-occurring disorders, and they report facing many of the barriers I just mentioned. But this particular survey that we saw reported that about 60% said that they had a lot of difficulty finding a trusted provider for their teen. About 60% reported financial concerns or the costs being too high, or that the stigma around getting treatment for kids was really a barrier. A majority, about 87%, do have medical coverage, but less than half of them said that they have the kind of coverage that will pay for mental health or substance use care. So that's a huge problem in our country, where we can have insurance and it'll pay for a broken arm, but it won't pay for mental health issues, even though that's against the law because it's supposed to. And we know that parents, it's not a bad option, is to turn to a pediatrician to ask for help. But unfortunately, in many cases, the pediatrician may not be trained at all in addiction care or in mental health care, or know really where to help or where to refer to the child to. And we also know that when it comes to kids themselves, there are, many reasons that they don't want to receive treatment. So there was a survey asking kids, why didn't you receive treatment? Even though you thought about getting it or tried. And again, stigma comes up as a big option. A lot of kids thought that they should have been able to handle the problem on their own. They're worried about what other people would think or say. They were worried that the information wouldn't be kept private that they shared with the provider. People thought that some kids thought that their family or friends, or if they belong to certain religious groups, would disapprove of them getting treatment. Again, this is nothing specific to adolescents. This is just in our country in general, the stigma or negative feelings around substance use and mental health care. It's a huge problem that we have to tackle, but the adolescents themselves still feel this, even though it's become a lot more common for young people to talk about mental health. I think that's just up to a certain point where you could sort of post about it online and talk about it in a casual way. But once it's actually pretty serious, and rises to the level of a diagnosed disorder, it's not considered as fashionable anymore to talk about your mental health, and it's stigmatized pretty severely. So we don't want to kind of confuse all the talk of mental health on social media among young people as a sign that the stigma is gone, because the stigma is not gone. We know that a lot of teenagers talked about not being able to access care. They didn't know where to go, where to get it. There were cost concerns, just like for their parents. Really hard to get an appointment. How do you get there? All those kind of barriers. And then there were some kids who just didn't feel ready for treatment or didn't believe that it would actually help. Some of that is well-founded. A lot of treatment that's out there is pretty bad and not effective. So for many kids, they're kind of right. But there's also a pretty bad reputation around treatment. And even though it's gotten a lot better in many cases nowadays, people don't really realize that. And many people don't really believe that, a substance use problem or a mental health problem could be effectively treated, unfortunately. So we want to just talk about like what parents can do, because again, hopefully most of you are not in the situation where your child has a diagnosed co-occurring disorder already, or substance use disorder, or even a mental health disorder, but maybe just, worried about it, starting to see some signs. So we always talk about the frequent and honest conversations, and it sounds very like bland and obvious. But again, why it's so important is because if you're deeply involved with your child and have these kind of casual, frequent, honest conversations about the issues we're talking about here, mental health and substance use, or even just about anything, you'll develop that closeness where if something does arise for your child, they may feel more comfortable coming to you and confiding in you about it. And you also may have that closeness where you could recognize that something's not right, where your child might need that little extra help. So if you know that your kid is, 6 days out of 7, a little bit irritable, a little bit jumpy, a little bit, whatever, and that just kind of continues, then you wouldn't say, oh, this child has a mental health disorder. It may be just like this consistent, persistent part of their personality. But if you notice a marked change in their behavior, so a child who's usually pretty pleasant, sociable, and then all of a sudden is sort of retreating or changing their mood or some changing in their appearance, you'll recognize that better if you have this kind of close relationship with your child where you're kind of seeing them all the time and talking with them a lot. And those can be indicators that the young person may need help. And you want to start that off with a conversation like, hey, I've noticed, you're not hanging out with your friends as much anymore, or you seem to be a little unhappy. Is there something that you want to talk about? So those are ways that kind of being close with your kid can kind of help there. We want to encourage pro-social activities in our kids. So that doesn't mean taking away their phones and their social media if they like it. But if that's all a kid is doing, it's probably not going to be the healthiest thing. So the more we can get them engaged in activities where they're contributing to their community, to their school, to their peer group, where they're having fun, where they're being challenged, those kids are going to be at lower risk. We always talk about modeling for parents. We want to model healthy behaviors, and we also want to model that it's okay to ask for help if you need it. So if you as a parent are experiencing some mental health problem or a substance use problem and you seek help, It's good for your kids to see you seeking that help because that is a good sign. That's something that we want to teach them, that if something's not right, there are people out there that can help you. So let's get the help for it. And we don't want to just suffer in silence or on our own. And for those parents who do have children at home who are misusing substances, and if you're concerned because of their mental health or their substance use, there are certain harm reduction techniques that are really important to know about. So, of course, we wish and hope that our kids won't use any substances or have any problems, but wishing and hope is not going to keep them safe and alive if they are misusing. What we want to make sure is that we have Narcan in the home, which is naloxone. That's the medication that could reverse an overdose if somebody accidentally or intentionally takes an opioid, especially fentanyl nowadays. So you may not think your child's misusing fentanyl, and hopefully they're not, but your child might borrow or take an Adderall pill from a friend just once, just to stay up late to study or just to kind of be awake enough to go to that party and have no intentions of harming themselves. But unbeknownst to them and their friend, that Adderall pill is fake and could have fentanyl in it. We don't want to have those kind of problems. We want to make sure that we have Narcan on hand in case something like that, God forbid, happens to our children or a friend of our children. And what we really want to do is be really open and honest with our healthcare providers that are part of our children's lives, whether it's a pediatrician, a therapist, a psychiatrist, even a dentist. Often we feel we have to kind of protect the reputation of our kids or not overshare. It's really important for the health providers in our child's life to know if that child has a mental health problem or any kind of substance use problem. Again, for, providers who prescribe medication, that could be dentists, psychiatrists, pediatricians, they need to know if the child has a substance use problem because that might or should affect the kind of medications they prescribe. They also should know if the child has a mental health problem because a child with a mental health problem who is prescribed certain medications is at higher risk of becoming addicted to those drugs if they are addictive medications. So the more honest we could be, the more likely we are to protect our kids from harm. If you do need treatment for your child, there are programs out there that provide integrated care. I know that notMYkid does a great job of providing services that are very sensitive to co-occurring disorder issues. Not many programs do, but they are out there, so certainly look for that. Again, like I mentioned earlier, family involvement is key. We want programs that will promote mentorship and recovery community and that provide continuing care and relapse prevention for people. Most people who have a substance use disorder don't just stop once and then that's it. They may relapse or, continue to misuse a substance again. That doesn't mean they're failures. It just means we have to kind of continue with the treatment. We do want to caution that unlike informal mental health treatment, there are apps out there and sort of services out there, especially online, that offer mental health care. Unfortunately, not all of these are very good or very reliable. And so we want to be really careful before we kind of have our kids use an online resource for their mental health treatment because a lot of it is unregulated and a lot of it is potentially harmful rather than helpful. So we want to be really careful about these are just some examples of what's out there online. But typically these are meant to kind of just give some emotional or mental health support, but these are not reliable. So please do look to a professional if you're trying to get help for your child. And again, just a couple more things about the care that a young person needs if they have co-occurring disorder. As we mentioned before, early intervention is really critical for young people. To the extent possible, we want to coordinate their mental health and substance use treatment together so that it's comprehensive and the whole person is treated. We don't want to say, oh, well, let's first treat their substance use problem. And then when we have that under control, we'll then start treating the mental health problem or the reverse. That's not effective for young people. What's effective is to kind of do them simultaneously and together. Make sure that kids have positive and supportive social interactions, healthy recreational activities, again, family involvement. And that last bullet where it says no wrong door, what we mean here is that what's most effective for young people is no matter how they enter the treatment system, whether it's through their pediatrician or in the ER after, if they've had, God forbid, an overdose or alcohol poisoning or a broken leg from an accident that they got while they were high or drunk. Anytime they encounter a medical facility, that should be an opportunity to receive the care that they need for their co-occurring disorder. And that's really what we're trying to aim for here. If they came in for a substance use problem, the provider should be questioning their mental health problems if they have mental health symptoms as well. If somebody is seeking care for their mental health symptom, it should be routine that some sort of screening for their substance use is made as well, because these two go together so often. And finally, just to show you what some kinds of treatments are that are effective for co-occurring disorders. Again, you don't have to be a clinician, just so that these terms are a little familiar to you. On the clinical side, we know that there are things like motivational enhancement therapy, cognitive behavioral therapy, in some cases, contingency management. These are effective treatments for people with co-occurring disorders. There are specific programs that offer family support that are really important for kids because kids tend to live with their families. So things like community reinforcement and family training, which is known as CRAFT, is a really effective way of teaching parents and family members how to interact with the young person who may have a co-occurring disorder. Invitation to change, again, it teaches communication skills for the parents. Self-care for caregivers is really important. And youth support so that they have substance-free activities, peer support, and coping and problem-solving skills. Just really quick, I know we just have a couple of minutes, a few really useful resources. So Partnership to End Addiction has a really nice manual report on co-occurring disorders and a feature on our website that gives a lot of great information. We also have free online support for parents and caregivers. There's a helpline, there's text messaging, there's online support groups for parents of young people or even not that young who are experiencing substance use and mental health issues. We have a range of resources that are specific to families of kids who are LGBTQ+. For those seeking treatment and having a hard time finding affordable care, we have a lot of resources that kind of help people understand how to access treatment, how to pay for treatment, what to do if their insurance is denying them. So really practical resources there as well. We work closely with another group called the Harris Project, whose whole focus is on co-occurring disorders, and they have great resources on their website about what parents should know and do, and also great resources for kids themselves. I saw in the chat somebody asked if you can get these resources. We will certainly share these slides. Happy to, and happy to also share our contact information if anyone has any questions or wants more detailed information. This is mine and Corey's email addresses, and our website is www.drugfree.org, where we have a whole range of resources and information for free. And I know notMYkid does as well have terrific resources, which Corey and I were so grateful to be able to see up front last week when we visited your facility there. So not sure if there are any questions, but I'll turn it back to Bree. Still there?
Yes, sorry, my mouse was lagging a bit. Thank you so much. I do not see any questions in the
Okay.
chat or the QA besides the one about the resources.
And is that true that you will share the
Yeah, if we get the slides, then we can definitely include that in the follow-up email that we'll be sending the recording.
Terrific. Well, thank you.